All right. Hello, everyone. Thanks for joining. We are scheduled to get started in a couple minutes. Looks like we're just waiting for a few more people to log in. And then we will get started with today's information session. Okay, it looks like most people have joined by now, so we'll get started. So we'll start with some introductions. So hello, everyone. Thanks for joining tonight's information session to learn more about our post-baccalaureate nursing program here at Massachusetts College of Pharmacy and Health Sciences. My name is Hannah Kassel. I work here in the admission office at our Manchester campus. So thanks so much for being here. We hope that you learn a lot about our program. And I do have a few colleagues here with me, so I will turn it over to them to introduce themselves.
I'll start. Hi, everyone. My name is Megan Kelley. I am the Senior Assistant Director of Admission on the Boston campus. I do work with all nursing students, the accelerated and post-baccalaureate nursing students coming here. I do see a few familiar names, so that's fantastic already. So I'm really glad you guys are here to join us tonight. I hope you get some really great information from myself, Hannah, our faculty, and our student that we have here. So thanks again, and I'll turn it over to one of our faculty members. Her name is Karen next.
Hi, I'm Dr. Karen Britt, and I am full-time nursing faculty on the Manchester campus. I started at the university back in 2009 as adjunct, actually, and then came on full-time in 2011. I teach primarily at the fundamentals level, and I also teach community and public health, but I have taught pretty much all of the curriculum at one point or another. So welcome. And Brett, I'm going to turn it over to you.
Hello, my name is Brett Simpson. I am from Windham, New Hampshire. I am in my last semester of the post-baccalaureate program at the Manchester campus for the School of Nursing. So I'm graduating in May. Very excited about that. My previous degree was in biology. I graduated from UNH Manchester, and I'm happy to entertain any questions that you guys have along the way. If you have any questions for me specifically, please put it in the chat and I can help out.
Wonderful, thank you. So yeah, we will be going through a presentation with you today to share more about the program. And there is a chat at the bottom of your screen, or a Q&A, I should say. So feel free to leave any questions in there as we go along, and we'll make sure to address those at the end of the presentation. And the other thing too, I just want to note is that this presentation will be recorded. So if by chance you need to pop out at any point, feel free and we can always send you the recording afterwards. All right, let's get started. So I'll turn it over to Megan.
Wonderful. Thank you so much, Hannah. So thank you. So first off, congratulations on your decision to pursue a career in healthcare. Healthcare is an excellent field to get into right now and always. This field is in really high demand, especially with an aging population. And the demand is really projected to increase over the next several years, as we can see here. The U.S. Bureau of Labor Statistics states that 1/3 of all new jobs through 2026 will be in the healthcare industry. With that being said, our students here at MCPHS are finding job placements very soon after graduation, some even receiving job offers before they graduate. Not only does the field of nursing have a very strong projected job growth outlook, but it also ranks upon the top 30 healthcare careers according to U.S. News and World Report. We do realize that returning to school, though, for your degree will definitely be an investment in both your time and your money. But based on the current job outlook, projected here and the quality of education we provide here, we really do believe that this will be a really good and wise investment of your resources. And there are so many opportunities to look forward to that we'll chat about today. But before we move on, I'd love to turn it over to the faculty to share a little bit more about the career possibilities in the nursing field. I'll start first with Dr. Britt. Would you be able to feel free to share some of your journey in the nursing field and what roles and responsibilities have you taken on along the way?
Okay. So I actually graduated from an associate degree program back in 1995. And during that time, there were so many nurses that I actually couldn't get a full-time position, which is not the case anymore. You don't have to worry about that. But so I ended up going to a 2+2 program. I transitioned to a BSN program. And my first nursing job was actually through the Center for the Disabled back in New York State. I started out as a camp nurse for that summer. I moved in for 3 months, working with the developmentally delayed population. I've also worked as a residential nurse in a group home through the Center for the Disabled. My acute care experience has included working at a neuroscience step-down unit at Albany Medical Center. I've done home care both in New York as well as in New Hampshire. And I've actually worked at 2 different home care agencies in New Hampshire as a visiting nurse and case manager. I also did some acute care experience out here in New Hampshire at a local hospital. And I worked on a med-surg floor for a couple of years, and then I transitioned into the role of a hospital-based educator. So that kind of stemmed my love of education because I was working with all of the new grads in the hospital, and I was coordinating all of the students on the units, my unit specifically. And so I got to really spend a lot of time with the students and the faculty. And I really was like, wouldn't that be interesting to try and transition? And one of the clinical faculty actually approached me and said, hey, have you ever thought about teaching, at a college? And so I did a couple of adjunct jobs at a couple of the local colleges, enjoyed that, taught clinical. Then I started teaching some of the classes as an adjunct, and then I did transition eventually to be a full-time educator. And since I've started at the university, I have actually gone back to practice 1 day a week, just to kind of keep my finger on the patient care aspect as a home care nurse. So it really, if you try something and it's not really your cup of tea, you don't have to leave the profession of nursing. You can just transition either through a different unit in the same facility or a different department, or you can move within the organization, a different outpatient perhaps versus inpatient, home care, resource utilization as through insurance companies. I mean, there are so many things.
Wonderful. What a diverse portfolio. Busy woman. Wonderful. Thanks so much for sharing that. Appreciate it. So if you hadn't heard of us yet, happy to share just some information about MCPHS here. We are a healthcare specific university. We offer over 100 programs in different fields, all healthcare related. And the university has been around for a very long time. We're 200 years old. We celebrated for a full year, and I think we're still celebrating. We all got little paperweights on our desk recently, so I think we're still celebrating. We may, lock down and hit the books, but we do love a good party for a year. We started with just a pharmacy program here in the Boston campus, and we've grown to really incorporate over 7,500 diverse students between our 3 campuses in our online branch. Healthcare is really our specialty, as I said, and many of our faculty are working in the healthcare field while also teaching, as we heard. So they're really well versed in the course material and are constantly staying up to date on the current healthcare system. As Dr. Britt said, she still has a pulse going on out there with what's happening in the field and patients. And then through school-sponsored events here that we have, and other social activities, which we have every week, our students do learn a lot about different healthcare professions, even before entering in the field. And we'll find out a little bit more about that in just a bit as well. Lastly, here, we really pride ourselves on maintaining our clinical affiliations with some of the leading medical institutions in the nation. More to come on that, but we have many, many clinical affiliations as we've been in business for 200 years. The field, the clinicals love our students, and our students love going out into clinicals. So with that being said, we've been able to establish a lot of relationships with clinical placements. So here is a look at each of our campus locations. First, the Boston campus. As I mentioned, we're 200 here. We don't look it. We look really good for 200 years old, but we are the largest and oldest campus, and the very first college in Boston as well. We're the oldest. Harvard is in Cambridge. But anyway, it's located right near the Longwood Medical area, which is surrounded by several well-known healthcare facilities that you may know of. A majority of the programs here in Boston we offer on this campus are really undergraduate, but we do offer a variety of graduate, doctoral, and even certificate programs here too. There is university-sponsored housing available for students at this campus, so keep that in mind. Even for post-baccalaureate nursing students, we do offer on-campus housing. The Worcester campus is about 40 miles west of Boston, and Worcester is home to our second largest campus, which was founded in 2000. It is the second largest city in New England after Boston, and is one of the most fastest growing hubs of innovation in the United States. NPR recently actually deemed Worcester as the new IT town. So you can't go wrong there. You'll study there and have a lot of fun as well, and be part of a lot of innovation. There you'll really find healthcare right at your fingertips. So for example, there's St. Vincent's Hospital, which is just steps away from the campus, UMass Memorial Medical Center, which is a part of one of Massachusetts' largest integrative healthcare systems. It's right down the street. And then there are other various healthcare opportunities within a 10-mile radius as well. All of the programs on this campus, the Worcester campus, are either graduate, doctoral, or post-baccalaureate, like the nursing program. There is university-sponsored housing available for students at this campus as well. Next, we have our Manchester campus. This campus was founded in 2002 and is located right in downtown Manchester, New Hampshire. This is actually the smallest of our campuses, and it's only about an hour north of Boston and Worcester campuses. It's all within driving distance to several healthcare facilities in the state of New Hampshire. Big ones include Elliott Hospital, you may have heard of that, Concord Hospital, Dartmouth Hitchcock Medical Center, and many more. There we do offer the post-baccalaureate program as well as graduate and doctoral programs on that campus. And it's really important to note too, one main difference of this campus, aside from it being not in Massachusetts, but in a different place from Boston and Worcester, is that there's no on-campus housing. The only housing available is off-campus. So that's really the differences of the locations. Now we'll turn it over to Hannah now.
Thanks, Megan. So moving on, so our university here at MCPHS has a reputation that's dedicated to the success of our students with an immersive hands-on culture. So starting with our interprofessional education, also known as IPE, at least once a semester, students participate in IPE activities where they engage with students in other programs. For example, nursing students may work with pharmacy students, and it's really a great way for students to learn a lot about other healthcare professions, how to work with patients from other cultures and backgrounds, and the functions of a team member, and how to work within a team once employed in the healthcare system. Now, I know, Brett, you've been involved in a couple different IPE activities on campus. Do you want to share a little bit more about those with the group in terms of what you got to do and how beneficial you feel those were for you?
Yeah, of course. So the most recent IPE event we had, so interprofessional, we all get in sort of either a classroom or just a meeting area. And am I coming through? Sorry, it seems like it's freezing. Okay, just making sure. Perfect. So we all got together in like a classroom. And in this case, we actually wrote a book. I actually have it here with me. The Spirit Catches You, and You Fall Down. And this book was sort of about how to deal with different cultures in terms of like delivering the best care for patients. So a lot of us are familiar with like the Western world and Westernized medicine, whereas other cultures have different like ways of treatment or different ways of care that they may choose to use to help kind of aid the process in healing. And so our idea is to kind of encompass all of that with our knowledge of Western medicine, and then work together. So me as a nursing student, and then work with pharmacy, work with PA, OT, PT, and kind of come up with a comprehensive plan on how to treat each patient individually rather than just having a cookie cutter set of ways to treat a patient. So I think it's great. It helps kind of make things specific and make things more, I guess, real for each patient. Everybody's situation is different, so you get to cater things around them. So I think working interprofessionally, that kind of helps alleviate some of the things that you might forget or leave out, because if you forget it, another profession will help you out and kind of fill the gap.
I also just want to say that it's MCPHS is very unique because we have so many health professions located within our campuses. So we have great opportunities to collaborate with other professions. And the idea is that if we start learning how to collaborate and learning each other's roles as students, imagine how much better the communication will be amongst the different professions after you graduate. And that's really one of the main ideas behind IPE, is making sure that, number one, you learn each other's roles, but also you learn how to be a part of a collaborative team so that you can have the best patient outcomes possible. On the Manchester Worcester campus, we do have 3 large events that we do each year. We do the cultural book club, typically in the spring. We do a roles and responsibilities inventory activity in the fall. And then in the summer, we do an opioid use disorder activity. And yeah, we're in the midst of planning. The cultural book club is going to be in March, and the opioid use disorder will be in June, which is very exciting. So those are the big ones, but we also have many, many small ones that we can participate in as well.
Amazing. I love it. We also have hands-on supportive faculty, like Dr. Britt, who is, right down the hall from where students have classes and labs in each academic building. And they have scheduled office hours, but are also available to help students with questions that they have throughout the day too. We are a teaching university, so our focus really is on your success and making sure that you are grasping the material so that you can go on and succeed in the field that you're looking to pursue. We also have resources throughout our Center for Academic Success and Enrichment, also known as the CASE department, to help students who may be struggling academically. We also have peer tutors and peer mentors who are available to help students as well. And we also have some on-site counselors for mental health emergencies and wellness, as well as a Center for Career Services, where they assist students with resume writing. They'll do mock interviews and tips and tricks for the job search whenever that time comes. And apart from academics, we also have options to join both nursing specific organizations as well as other cross programmatic clubs. But the nursing program may certainly be a busy program, and you're going to have a lot to do, but there's always plenty of opportunities to get involved outside of school and things like student government, campus activities, fundraisers, and drives. Brett, you were part of one of our clubs on campus, is that right?
Yeah. Yes. I'm a part of actually a couple. Well, one club in particular, student government. I am the class or the student body secretary, and then I'm also the nursing liaison for my cohort that's about to graduate. And honestly, it's a blast. We kind of get together with other interprofessional, like the PA program. We get together with the pharmacy program and all of those representatives, and we plan activities and kind of stress relieving tasks for the student body. So at Manchester, in particularly, we just hosted a Pie the President event where we donated all funds to a local women's shelter, and everybody got to throw a whoopie pie in my face. So it was a good event. We had a great turnout, and it just kind of boosted morale for the entire school and also helped a good cause. I'm also involved in peer mentoring and peer tutoring. Peer tutoring, I kind of help with the didactic portions of a material, and then peer mentoring, I help kind of get you adjusted to the MCPHS life, and then how you can kind of work in a work life or a work life school balance. Because I know a lot of people kind of have other things going on coming into the program or something like that. If you want something personally, I particularly, in terms of work, I work usually like 16 to 32 hours a week, depending on school and how much things are due. So I think that it's completely doable to have a school life work balance, but keeping that school first mindset is definitely a key. As long as things are going well didactically, I think that you can kind of branch out and expand upon things, and there's so many endless opportunities.
Wonderful. Thank you for sharing. And here's a quick just at our list of our nursing programs that we offer here at MCPHS. So we have our post-baccalaureate nursing program, which is what we're here talking to you about today. So this is offered across all three of our campuses, Boston, Worcester, and Manchester. And it's our 16-month year-round program. So it's a total of 4 semesters. And there's 2 different start dates in which you can begin the program. You can either start in the fall, which begins in September, or spring, which begins in January. We also offer a traditional 32-month program, and it's an accelerated BSN program at our Boston campus. It is technically, accelerated, but it is a traditional program, so it's mainly geared towards students who are coming right out of high school or transfer students who don't already have a degree yet. And then lastly, we also have some graduate nursing programs, which are all offered in a convenient online format. So once you get your nursing degree, if you're looking to branch off and continue forward, we do have an online family nurse practitioner program. We have a psychiatric mental health nurse practitioner program. Both of those are offered in the MSN, so the Master's in Nursing, as well as a graduate certificate program. And then we also have a Doctor of Nursing practice program to reach your highest potential in the field of nursing. So that is just a quick glance at our programs. So again, we're here talking about our post-baccalaureate nursing program. So that's going to be designed for students who already hold a bachelor's degree in something other than nursing and are looking to become a registered nurse. So during the nursing program, our nursing students do have access to a wide array of different resources to aid in their learning process and prepare them for a future career as a nurse. And throughout the program, our students have access to the use of educational technology, multiple clinical experiences in a variety of different settings, NCLEX preparation, and the use of state-of-the-art labs and facilities for their labs, as well as their clinical experiences. So with that being said, I'd like to turn it over to Dr. Britt again. Would you be able to share a little bit further into some of the lab exposure and some of the different the technology that our nursing students get exposure to in the program, and maybe touch on some of that NCLEX preparation as well, if you wouldn't mind?
Sure. So we start right in the first semester with our lab time. We have weekly labs for both health assessment as well as basic nursing skills. We start clinical the first semester as well. So the beginning of our lab sessions are really getting you geared up so that you know how to do some basic patient care, vital signs, bathing, hygiene, safe mobility, repositioning, nutrition. Those are the basic first ones anyway, to get you up and running so that you can be safe at clinical. And we also start towards the end of the semester introducing some really basic simulation. The idea behind simulation is that we try to give you the most rounded clinical experiences that we can, but we can't guarantee certain types of patient care, certain types of situations that we guarantee that you get. So the idea is that we can guarantee certain situations, certain patient care situations, I should say, by giving you a simulated patient experience. And that's the idea of SIM. So you have a chart that you would review, and it is electronic. We use electronic charting through different technology products, online web portal access, things like that. And so you would review the patient's chart, you would get a shift report, and you would go into the simulated clinical environment, and you would take care of your patient. You would have maybe LNAs on your team, or another nurse, charge nurse. If you needed to call the provider, you would be able to actually call someone, and they are the provider that you're reporting changes in patient status and getting orders and things like that. And then after you have completed your simulated experience, I think even more than the simulated experience, the debrief of that simulated experience is ideal, because it's a learning opportunity. It's for you to be able to recognize what you did really well and what, I kind of struggled with that. How can I improve if I come across something like this again? And it's not just an individual sim. You have your fellow classmates, a couple of classmates in there with you who are partnering with you to provide the care that you need to give. As far as, and so that was the beginning. And then each semester, simulation expands on depending on the topic that you're learning at the time. And then by the time you get through the final semester, you actually we have sims that you have multiple patients that you're caring for at the same time. And it's ideal so that you can have an opportunity to manage those very challenging patients with faculty and other student helping you through it. As far as NCLEX prep, we start again right in the first semester. Our NCLEX test plan has changed, and the types of questions that you are being asked on your licensure exam they have all changed. So we start right in the beginning. We do practice questions in class. We have pilot practice questions on exams that are sometimes graded and sometimes they're not. But the more we expose you to those types of questions, the better you are with those types of questions by the end of the program. And we try to make sure that repetition is the key, and exposing you to as many different things as humanly possible. We try to do it all.
Wonderful. Thank you. It sounds fun. So I also want to turn it over to Brett. So Brett, obviously you've been going through the program. Is there a particular lab experience that really sticks out for you in terms of like your favorite lab that you've ever done? Because I know you're about to graduate, so you probably have done many, many different labs. Any particular one that sticks out for you?
Yeah, so in particular, this entire semester has been amazing for lab because we're in the last semester we deal with critical care and kind of dealing with patients that their outcome may not be the best, but we provide the best care to kind of turn around that outcome. So seeing somebody kind of at their worst and with the idea of hopefully improving and kind of sending them home once they're at their best, I think that's the most rewarding feeling. So recently, we just had a case on, we had a patient who had a heart attack and we got to set up an EKG. We called the provider. Got a bunch of orders in and then stabilized the patient. And so it kind of helped simulate what would go on in like the clinical setting. So for me, I think there's really no favorite in terms of lab. I think lab in general is a great opportunity for me to kind of make mistakes and have that be okay. And be able to be comfortable in those situations when it comes to real life. So if I walked into the hospital during my clinical and a patient had a heart attack and it was my patient, I'd probably panic and freak out. But because we've practiced that in the lab setting, it's been like a 180 shift in terms of my nerves and being prepared for what could potentially happen. And that goes systems and we kind of try to cover everything that you might see within the hospital setting.
Wonderful, thank you. That was actually one of my other questions I was going to ask you is how do you feel your lab experiences have prepared you for your clinicals? And it sounds like they've prepared you well and that you feel more comfortable.
Yeah, I think that it's monumental, especially for so me particularly, I worked as an LNA for 4 years, and kind of making that transition from an LNA to a nurse is very hard for me because I'm stuck in the way of I've been an LNA for 4 years and learning all these new things was very hard for me to adapt. But kind of practicing everything in lab, being the role of the nurse, kind of helped flip my mindset of what my responsibility is now. And whether you've been in healthcare or not, these labs help prepare you so that you don't feel like you're thrown into the wolves or like that you don't know what's going on. So we have people in my cohort that are lawyers, and computer science engineers. One was in the military, and they all are confident. And watching them grow throughout the kind of the program has been like amazing to see. So I think that it kind of puts everybody's mind at ease.
Wonderful, thank you. Yeah, there are so many different applicants who come from many different backgrounds. So there's not one, cookie cutter way to do this. Everyone has their own journey. So it's definitely exciting. Um, So moving on, I wanted to talk a little bit more about our clinical experiences that students in the post-bac nursing program get exposure to. So Dr. Britt, I'll turn it back over to you. Would you be able to share a little bit more in terms of the different clinical rotations that that our students do, where they complete them, how they're supervised, how they're assigned to them, basically how that whole process works for students.
Sure. So like I said before, we start right in the first semester with fundamentals clinical experience. It is usually in a long-term care facility, or it can also be in acute care. You never go to clinical on your own. You will always be supervised by someone. In the beginning, clinicals, you will have a clinical faculty that goes with you. In New Hampshire, the maximum size for a group is 8, and that is determined by our New Hampshire Board of Nursing. In Massachusetts, the maximum number is 10. And again, that is determined by the Massachusetts Board of Registration, and we comply with our each specific board regulations for that. It does not mean that we always keep to that maximum number. For example, the majority of our beginning clinicals are 5, maybe 6 students in a group, so that we can give you more one-on-one, supervision and like guidance, so that you can really master some of those basic skills and build your confidence, so that you can really succeed in like building your scaffolding of confidence and patient care experiences. The second semester is basic med surg. So we do acute care settings in a hospital. Again, you will have a clinical faculty with you one-on-one. The third semester, you will go to pediatric experiences and maternity experiences with a faculty person, clinical faculty person with you. Your final semester, you will have advanced med surg, or I'm just going to call it advanced med surg. So you can still go to a med surg unit, but instead of just a basic med surg, we try and put you on maybe a cardiac unit, or something that is just a little bit more advanced skill, so that again, you can scaffold your learning experiences and practice some of the didactic learning and translate that to patient care. You may be in a group for your final semester clinical, or you may have a precepted experience where you actually follow a nurse on the unit, their schedule you follow. And that's dependent on, really dependent on if the facility allows us to have preceptors versus groups, and the availability of competent preceptors to oversee our students. We have to make sure that they have certain criteria, meet criteria as determined by our Board of Nursing, as well as our accreditation. I'm sorry, what did I miss something, Hannah?
No, you hit it spot on. The one other question we generally get to is like how people are assigned these clinicals, whether they can choose or if they're already picked for them.
So the current practice right now is that the faculty who teaches the course, who coordinates the course, they're the ones who determine where you go. Like, we have a pool of places that we've requested, and the sites say, yes, you can have this time, this day. We don't get to determine if we get like an evening or a day or a weekday versus a weekend. That's determined by the clinical site themselves. They tell us when we can come. Once we have that information, our next step is we find clinical faculty that can work those shifts that we've been offered. We also take a look at where you live, and we try to put people closer to where they live, so that you don't have to drive 2 hours in one direction to get to a clinical site. We also look at, have you been at this particular place, like this particular hospital for previous, because we like to give you opportunities to go to different facilities and see what other opportunities you have available after you graduate. My advice for you is to treat every clinical opportunity as a potential job interview. So not only are you interviewing the facility, but they will remember you when it comes time to apply for a job there. As far as clinical placements go, the Manchester campus will place you in New Hampshire hospitals. That is something that has been determined, that we only place in New Hampshire hospitals, but we have such amazing facilities up here. So I think there's a misunderstanding that students only get great experience if they go to Boston hospitals, and that's really not true. Because once upon a time, we did have Boston placements here in Manchester, and they weren't always as good as some of the ones of our local hospitals. So I just want to plant that seed to kind of maybe get rid of that misconception. But we have Dartmouth Hitchcock, Concord, Elliott, CMC, St. Joe's, Southern New Hampshire, Portsmouth, Exeter, Wentworth Douglas. I mean, we have so many hospitals. They're amazing facilities.
Perfect. Thanks for sharing. Brett, would you be able to share a little bit more about your clinical experience that you've had in terms of the cool things that you got to do during your clinicals, where you did your clinicals? And I know your schedule is super busy, so maybe talking in terms of like how you went about balancing your classes and your labs and in your clinical schedule.
Yeah, definitely. So currently my clinical is at Elliott Hospital. And when Dr. Britt says treat every clinical like a job interview, she's 100% correct, because the second I walked into my clinical this semester, which is a preceptorship, um, the nurse manager goes, "This is your job interview. Uh, you, you're hired at the end of this, barring any extraneous circumstances." And I was like, "Oh, okay." So she truly does mean it when most of these sites will remember you. And it's been great. I've done clinicals at Elliott. I've done them at Southern New Hampshire Medical Center, which is in Nashua. I've done them at um, Hillsborough County Nursing Home, which is actually a reason as to why my grandfather goes to Hillsborough County now. So we've kind of had a nice diverse background of hospitals. As far as things that I've done in clinical, you name it. I've done CPR, I've done postmortem care, I've helped in a postpartum hemorrhage, I've observed a total lobectomy, which is actually a removal of one side of the lung. The surgeon let me hold the lung. um, so, and then I've also assisted in mechanical ventilation and intubation this past semester. So I guess the possibilities are endless. My suggestion for clinical would be to jump at every opportunity you can. Doesn't mean that you can physically like do it. Like if there are parameters that you can do, but you can always watch, you can always observe. And if it's guarantee you that you should take advantage of it, and I know that your clinical faculty will help you take advantage of that. Their goal is for you to have the best experience so that you can kind of figure out your niche within nursing. Nursing is so broad and there's so many different jobs that they kind of help you kind of narrow down what you're looking to do as we get closer to graduation. As far as balancing this, then it's nice for the first 3 semesters. Your clinical schedule is a set date, so you get that in advance, and you can mark it off your calendar. So if you're working, you are not working on the day that you have clinical. And so it's nice because you get it in advance. You can schedule your shifts if you were to work around that. As far as my last semester preceptorship, it's really nice. I get to schedule it with my preceptor, so I kind of follow her schedule. And I can pick the days where it's going to work for me. So barring if I have an exam, I'll maybe go once a week. If I don't have an exam, I'll go 2 to 3 times a week. It just depends on the workload. But like I said before, everything is manageable. It's going to be, I always say patient specific, but it's person specific here in this instance. You just want to make sure that school comes first. You're doing well didactically, because the didactic truly does match up with what you're seeing in clinical. I didn't necessarily think that would happen when I first applied here. And then I was very surprised the first day of my clinical that like we literally learned not even the day before, and I saw the exact patient or similar patient as to what we were learning. So I think that as long as you have didactic down, it's manageable and definitely doable. So don't rule anything out.
Thanks, Brett. I appreciate it. So hopefully after today's presentation with all the great information that Dr. Britt and Brett have shared, you'll want to think about applying to the program. So with that being said, I'm going to turn it over to Megan again, and she'll share a little bit more information with you in terms of how to apply to the program and what that looks like.
Actually,
Awesome.
there is a question in the chat if you want to address that.
Oh, sure, absolutely. I typically do after, but I can definitely do that right now. Just in case, you know, the person has to go or something. There is a question, do you provide need-based aid for this program? We will get to that, but we do offer scholarship for this program. So all students are qualified for scholarship just merely by applying. When you do receive a decision from us, you will also receive notification of that scholarship. Additionally, we do encourage students to apply for financial aid, and usually that has, you know, something if a student does qualify. Typically, we see subsidized, unsubsidized loans, but if there is anything additional that you haven't used in your previous bachelor's degree, sometimes there's that. And then we do meet with students individually based on need to see if there is any additional funding. It is a case-by-case situation, but if there is a concern for you, you're more than welcome to reach out to Hannah or myself, and we can sit down and look at affordability and everything. It's not guaranteed, as we always say, but we can at least exhaust the opportunity for you by sitting down and meeting with you and going through that. So perfect. And then for the student who has to leave, we will certainly send you the recording. We'll send it to everybody here. And if it's possible for a fee waiver, Hannah, if there are any, we will be in touch with you regarding that. So thank you so much. Okay, so for those of you ready to apply, as we previously mentioned, we do have 2 different start dates per year for the post-bac nursing program, the fall and the spring. Right now, we're accepting applications for the fall 2024 semester, and we do welcome you to apply. We would love for you to apply. Applications are accepted on a rolling admissions basis, so it's best to submit your application as early as possible for priority consideration. We are kind of looking at a May 1st deadline, I would say. But to apply, you should complete the Nursing CAS application and send all of your required admissions documents there. The documents that are required are of all official transcripts from all colleges and universities you've attended. We do require a transcript evaluation and translation if you have any international coursework. If it's not English, again, it has to be translated as well. And then we do require a personal statement, somewhere between 500 and 1,000 words, describing your goals, reasons for pursuing a bachelor's in nursing now at MCPHS. Students who apply to the Manchester campus do need to send in a high school transcript if you're accepted into the program. But you can wait to request it if necessary, but we will need you to submit a high school transcript no matter how long you've been out, okay? And one amazing thing, I guess it's kind of 2, there's no GRE required. So we get this question quite a bit. A GRE is actually for graduate school, and since this is technically a second bachelor's degree, we don't need a GRE. And for this program alone, the post-baccalaureate, we do not require a TEAS exam. So you can at least sit back and not have to worry about those 2 things anyway. I'm just typing out my email for a student who asked. Okay, awesome. So these here are the prerequisite courses that are required for the post-bac nursing program. Anatomy and Physiology 1 with lab, Anatomy and Physiology 2 with lab, Microbio with lab, Gen Chem 1 with lab. We would also look at college chemistry or another synonymous chemistry. So keep in mind, if you don't have general, but you may have college and that's all that your university may offer, we can take a look at that as well. Then we'll look at general chemistry 2 or nutrition with lab. So if you were, let's say, a biochem major and you took chem 2, but you never took nutrition, that's fine, we'll take 2. Let's say you were a human development psych major and you never took chemistry at all, so you have to take chemistry 1. And then the other one, you can take nutrition. So you don't have to take 2 chemistries, which my students are pretty happy with when I talk to them about that. Next, we have human growth and development. Introductory level psychology will not qualify. Abnormal psychology will not qualify. We want a true human growth and development from birth until death, covering the entire lifespan. Any questions, you're welcome to reach out to us. And then lastly, statistics. These courses can be in progress when you apply. If you took them for AP credit, you want to make sure that you send your AP test scores from the College Board, as we do require a 4 or a 5 for those classes. And then some of these courses are offered via CLEP, but they do have to be a 50% or higher, and there is a 10-year age limit on those. So just keep that in mind when you are, looking at what you've taken in the past. If you're missing any of these coursework or any of these courses and you're interested in taking them with MCPHS, we do offer several of them online through our School of Professional Studies, which again, I mentioned is our online branch. Our online prerequisite courses there are self-paced, and new students are actually eligible to receive a 50% off cost reduction or discount, whatever you want to say, in costs, or 50% reduction in costs. If you do take it through our School of Professional Studies, there is a discount code you need though. So just keep that in mind. We're open to accepting credits from other schools and universities. It does have to be regionally accredited, so just keep that in mind. If you have any questions at all about that, definitely feel free to reach out to Hannah or myself, and we're happy to go over that.
Perfect. Thanks, Megan. And then I just wanted to quickly touch on housing. So I know we briefly mentioned this at the beginning, but if you are interested in living on campus, we do have on-campus housing at our Boston and Worcester campuses. There's a bunch of different housing options, from suites to singles to apartment style condos. So if you are interested, you can definitely feel free to take a look at the different options that we have on our website. You can feel free to come for a tour. We're happy to show you around. But rent would be charged once a semester, and they come fully furnished with utilities included. We do not have housing on our Manchester campus, but it hasn't really been much of an issue for some students because they usually find apartments or condos outside of the Manchester area or within Manchester. So we actually do have a great off-campus housing page on our website, which has some recommendations in terms of places to look. So don't let that hold you back. If you ever have any questions, I work on our Manchester campus and I'm more than happy to assist you. I've lived in Manchester and the surrounding towns, so I'm happy to go through and provide any recommendations for you if you need that from a person. And then I know we already touched on financial aid, but just to go over it quickly again. So as Megan mentioned, we do offer merit scholarships for students, and we'll definitely consider you for one when you've applied to our program, which helps cut down on the cost of tuition significantly. So keep an eye on that when you've applied to the program. We'll definitely consider you for it. FAFSA, I highly recommend to fill that out as well to see what financial aid you qualify for. Usually students will fund the program with a combination of financial aid through the FAFSA, private loans, scholarships, and we also offer payment plans too if you are interested in that option. But we do have a great student financial services department. So if you do have any questions for them, they do offer appointments for students. So feel free to schedule one with them. Megan or I are happy to get you in touch with whoever is the contact for your particular campus. And then we just put some FAFSA priority deadlines. These are just dates when we would prefer you to apply for FAFSA, but don't sweat it if you haven't, applied for FAFSA by March 15th and you're applying for the fall start date. You can definitely apply after that. But FAFSA is changing this year. So we are going to start sending out financial aid award letters in March. So I would say just try to shoot to get your FAFSA application in as soon as possible, just so we do have enough time to consider you for that. But that does it for today's information session. Just trying to get up here our contact information. So I put myself, so I work on our Manchester campus with all applicants interested in applying to Manchester. I put my colleague Christian's contact information. He wasn't able to be here today as he was out at a fair, but if you are interested in applying to Worcester, definitely take his contact information down, as he'll be your go-to. And then Megan is our contact at our Boston campus. So feel free to take our contact information down, reach out to us if you have any questions. We also have some great YouTube videos on our YouTube page, so feel free to check those out. You can follow us on Instagram as well. And we do have campus tours, so if you're interested in coming to campus and seeing our facilities, we're happy to tour you around and show you all the great spaces. Then we do also have an open house coming up as well at our Worcester and Manchester campuses. So our open house in Manchester is April 6th, and the open house in Worcester is April 27th from 9 to 1. So feel free to register for that. You just go to mcphs.edu/visit, and you'll find the registration details right there. But we'll stick around for another couple minutes just in case anyone has any other questions. But if you don't have any questions, like I said, this is going to be recorded. So if you want the recording, feel free to reach out to Megan or I, and we're happy to send it to you. But thanks so much for attending. We'll stick around for a couple minutes to see if there's any last minute questions.
Hannah, we did get a question about a nursing CAS waiver. Do you have access to those, or are there any available?
Yeah, I do have a couple left. If they want to reach out to me, I'm happy to provide one for them. I'll put my email for them.
Yep.
Any other questions that anyone has?
All right, I think we can wrap it up.
Quiet
So
group.
thank you so much, Dr. Britt and Professor Fatma, for being here today. Brett, thank you also for your expertise and your knowledge and, being a student here. Appreciate all of you. Hannah, great working with you as always. And I hope everybody has a wonderful evening and stays warm.
Perfect. Thanks, everyone. Have a good night.
All right. Bye.